My work is going to be a little bit more about voice and a little leaning towards health. So thank you, Marissa, for sort of like putting me into the vital sign category, because I'm going to talk about voice as a vital sign. And what AI has now been enabling us to do is actually use voice as a way to tap into health. So I want to start with this clinical case because I think it highlights a gap. There's a gap in the sense that what we can measure and how individuals are in fact reacting to their health. So this is James. He's 68 years old. He woke up with shortness of breath and feeling fatigue. And he's been living at home pretty independently with the help of his daughter. His daughter did everything right this day. She actually weighed him, because that's typically what happens with people with heart failure, is that they might have fluid retention. The weight was fine. When she checked his blood pressure at home, everything was fine. But 3 days later, he ends up in ER and is hospitalized. So what a 20 to 30 second sample of voice could have done for this man was actually helped him stay out of the hospital and reduce the cost. And so I think this is all about the fact that a lot of health conditions drive up the cost, and yet independently we can actually measure remotely with signals such as one's voice how to keep them out of the hospital. So what can we do? Well, the art of listening has been around for centuries, really. You know, in the past, clinicians used their ears. They would actually put their ear all the way to the patient's back and listen to see what was wrong with them. And then, of course, in 1816, we have Laennec, who came up with the stethoscope, and he turned the stethoscope into this instrument of listening, right? Today, we have an incredible instrument as well. We have the microphone. The microphone is our instrument, and we're powered by AI. It allows us to see and hear signals that we could not before. Rather than top down, thinking about which features might be important for which diseases, we can let AI help us determine what the concert of features are that lead to different kinds of diseases. Okay, so I really want to advocate for voice as being this vital sign, not just for physiological disease of health, but also for mental health impairments. And so voice is a really fine fine motor instrument where differences in voice can be detected even before you see the clinical signs, right? Even before you see gross motor signs, because the movements in voice are very precise, it actually is a really good predicator of different kinds of diseases. It's also low cost, low friction, right? In fact, also pretty agnostic to language. From a sustained ah, or when the doctor asks you to say anyways, right? Open your mouth, say ah. From sustaining that ah, we can get a lot of information about the internal physiology of the individual. So here's a spectrogram. A spectrogram is essentially a visual display of speech. And in here you can see pitch changes and loudness changes over time. And we can measure a lot of things from a spectrogram. Everything from what is happening at the precise level of speech in terms of things like jitter and shimmer, which is essentially changes in pitch and changes in intensity over cycle-to-cycle variations. So a female voice basically changes at 220 times per second. The vocal folds are opening and closing. For male voices, around 110 times per second. That small perturbation in voice can tell us a lot about what's happening at the phonatory level and neuromuscular control. Now, if we look at a larger signal, for example, how often is someone taking a breath? That can tell us something about their respiratory system. So there's a lot of cues in voice that have kind of been undetected and we have been ignoring for a long time. So how it works is we simply give someone either a smartphone app or a web-based app in which they record a variety of short phrases. And like I said, 20 to 30 seconds is almost all we need. So sustained maybe a phrase that has a bunch of different kinds of phonetic context in it, and then some free speech. From that, we can then analyze the voice relatively quickly, almost in real time, and provide some feedback to the individual. The machine learning part of it is we can build classifiers to look at between individual differences, and then we can also build deep learning models that find features that are consistent for different kinds of disorders. So we're using different kinds of models of AI in order to detect what may be going on, as well as to monitor changes in health. So going back to our vignettes, so this is some work that I've been doing with my collaborators in Germany, Zana Labs, as well as Maastricht University. So this is the heart failure case, just like James. So the reason why heart failure shows up in voice, and in fact you've probably heard during COVID, A lot of people using voice and cough as a way to measure whether there was a higher prevalence of COVID or not. Similarly, with heart failure, what you can see is that as someone's heart begins to retain fluid, that fluid change is also going to show up in the vocal folds because that tissue, the epithelial tissue, is similar. And then we can measure that at the level of the microphone and then go back to see what is going on. So in this study, we had 131 patients, and we were able to find specificity of 81% and specificity of 79% and sensitivity of 81% with a pretty good area under the curve of 0.91. So again, we're able to detect what is going on. This could have saved James from having to go to the hospital because we could have seen that he was heading toward heart failure in that crisis, right? Similarly, we've been doing some work in pulmonary disease, and this is for patients with COPD. Here, a group of patients were studied to see how well we could detect and how early we could detect that they were going to go into decompensation for their COPD. And we could tell between about 3 days before they actually had an exacerbation that was measured and visible that they were going to have an episode. So that's actually really exciting. So even before you see symptoms, you can tell in voice. So very exciting in terms of some of these physiological diseases. One of the things we've learned as we've been using voice as this thermometer or vital sign for health is that there are other confounds. And one of the confounds is hormonal changes. So my lab at the university, sort of rebranded as I come back from a leave of absence, has all been focused on women's health. And we see that as women go through the menopausal, perimenopausal phase, their voice changes dramatically. And the reason is because of hormonal changes. So we know hormonal changes in estrogen, progesterone, and androgens during the time of perimenopause and menopause will have a certain impact on voice. Changes in pitch, so a lower pitch sound, slight changes in breathiness, and so on. And these changes also are similar changes that happen in neurological conditions and other physiological conditions. So part of what my lab is trying to do is dissect or pull apart what is due to regular aging changes in women's health versus what might be due to early signs of neurological diseases or other physiological diseases, primarily cardiovascular diseases, because that is quite common in women. So we want to disassociate those, and that really hasn't been studied before. What has been shown is that there's differences in men's and women's voices, but not why those differences occur, and whether we can find different vocal signatures for a physiological change versus just a healthy aging change. More future work that we're doing, along with my colleagues here at Northeastern University, are looking at the interaction between sleep and next day cognition, using voice as well. So we analyze speech patterns and sleep patterns, and snore patterns actually too, with voice acoustics, and we can tell whether people have had good sleep. We also put wearables on them while they're sleeping so that we can get other signals. So we have this multimodal signals coming in, and we're using voice to then differentiate what's going on with next day EMAs that we ask about cognition. So these are sort of a variety of different ways in which we're using voice to tap into health, but not just physiological health, but also, like I said, mental health as well. And with that, I just want to say that I think there are lots of tools that AI is enabling us now to use, different kinds of streams of input, and that input now, rather than top-down thinking about which features might matter, we can discover features and groups of features together, which I think is a really exciting area. I kind of feel like voice and speech science fits somewhere between social science and health science. It's kind of in between, so I guess I feel that crack in between there. So thank you very much.